So now this is a very common question we patient generally ask. I have a disc bulge, do I need surgery? I have a fracture in the spine, do I need surgery? So some people come with a spine reports, MRI reports, CT reports, and they ask us whether I have a bulge, do I need surgery? So the how to decide whether you need a surgery or not, that is very simple. If you have severe symptoms mean you are not unable to walk, you are not able to maintain your lifestyle, the pain is unbearable in spite of medical and physiotherapy, then you may need a surgical surgery. That is to your decision is the final decision, because you have to decide whether surgery is needed or not. It's a choice rather than a compulsion. So some of the patient come with a fear, if I don't get operated I'll be paralyzed. The chances of getting paralyzed with a lumbar spine disc is very less. So do not panic, because chances of having paralysis is very less. If you don't operate also, the chances of having paralysis is very less. So why we operate? For a better lifestyle, because the pain is so unbearable that you have to take a lot of leave from the your workspace. You don't have to you cannot work properly, you cannot play sports, you cannot do morning walk. So all these conditions which are needed to decide whether you need surgery or not. So if you have a very large disc bulge, unable to walk, having severe stiffness and severe pain which is not getting relieved by medication and physiotherapy, then you come in that 5 to 10% group which needs surgical intervention. Rest all 90% who have whether you have a disc bulge, fracture or compression, do not need surgery. And especially in elderly patient, where there is a prevalent condition which is known as canal stenosis, where patients are not able to walk for more than 500 meter. In those conditions, they can choose for a surgical option for a better walk and lifestyle. That is the only indication of surgery. And also, if we have an infection in the spine which causing severe pain, which is not controlled by medication or antibiotics, then also you may need surgery. Spine fracture in elderly are now recently managed with kyphoplasty, which is a very least minimally invasive surgery, where with a needle we can go there and put a balloon and inflate your bone and put cement in that, which is a magical cure for elderly patients. So most of the cases now can be handled. If you need surgery, then most of the cases can be handled with a very minimal invasive procedure, which is very safe. So always, if you are planning, a doctor is advising for a surgery, then choose the most recent technique possible. Thank you so much.